Hello, my name is Beverly Strong, and I am a psychiatric nurse practitioner student. In this first case, I'll be discussing how I would manage a crisis involving a 45-year-old male with a history of major depressive disorder. This scenario focuses on acute suicidal ideation in the outpatient setting, where my role as a psychiatric nurse practitioner is to recognize risk, maintain safety, and respond effectively while providing compassionate care. I'll walk through how I would assess the situation, determine the appropriate level of care, initiate emergency interventions, and plan for ongoing treatment after stabilization. My approach combines evidence-based assessment tools, crisis communication strategies, and ethical decision-making to ensure the patient receives immediate protection and long-term support. In this case, this patient has a history of major depressive disorder and pornography addiction, which previously caused strain in his marriage. For the past 5 years, things have been going well. His mood has been stable on citalopram 20 milligrams daily. He comes into my office visibly upset after discovering that his wife has been having an affair for the past 2 years. She has left him, taken their children, and filed for divorce. He reports drinking about a six-pack per night and admits he's been having suicidal thoughts with a plan to shoot himself. He says the only thing keeping him from acting on it is his children, but he feels he's losing hope of ever seeing them again. My first priority is safety. Anytime a patient expresses suicidal ideation with a plan and access to means, that is an emergency. I would begin by conducting a suicide risk assessment using the Columbia Suicide Severity Rating Scale to document the intensity, frequency, and intent of his thoughts. However, given what he's told me, I already know he meets criteria for imminent risk. At this point, I would not allow him to leave the office or be left alone. I'd stay with him, maintain a calm and compassionate tone, and tell him, I can see how much pain you're in right now, and I want to help you stay safe. I'm worried that you might harm yourself, so I need to get you somewhere that can help support you 24 hours a day until you feel more stable. Next, I would initiate an emergency psychiatric admission for stabilization. Depending on the clinic's policy, I would contact emergency medical services or a mobile crisis team to transport him safely to an inpatient facility. I'd also assess for firearm access and, if needed, coordinate with a trusted family member or law enforcement to secure the weapon. Throughout this process, I would continue therapeutic communication, validating his feelings and reassuring him that hospitalization is not a punishment but a step towards safety and recovery. From a legal and ethical standpoint, I have a duty to protect, even if it means breaching confidentiality. Under Texas law, emergency detention can be initiated when someone poses a risk of serious harm to themselves due to mental illness. My documentation would include the patient's verbatim statements, results of the risk assessment, my rationale for involuntary admission, and the actions taken for safety. Once this patient has been stabilized and discharged, I would focus on continuity of care. This includes medication management, therapy, such as cognitive behavioral therapy for suicide prevention, and integrated treatment for his alcohol use disorder. I would also work with him to develop a personalized safety plan and connect him with community supports, such as a divorce recovery or single father group. These connections help restore meaning, purpose, and protective factors. In summary, this case represents a clear psychiatric emergency that requires immediate and decisive action. The most critical step is ensuring safety through inpatient admission. By staying calm, communicating compassionately, and acting swiftly, I can protect the patient while building trust for a long-term recovery. Following stabilization, coordinated care, including therapy, medication, and addressing substance abuse, supports his path toward healing. This case reinforces how essential it is to act within ethical and legal guidelines and how empathy, structure, and composure save lives. As a future psychiatric nurse practitioner, I understand the responsibility and privilege of guiding patients through their darkest moments toward hope and stability. Thank you.